Assalamu alaikum, Bismillahirrahmanirrahim. So today's video is on glaucoma. Let's begin. So this is an eye condition that damages the optic nerve. This damage can lead to vision loss or blindness. The optic nerve sends visual information from your eye to the brain and is vital for good vision. Damage to the optic nerve is often related to high pressure in the eye. However, glaucoma can happen even with typical eye pressure. Glaucoma can happen at any age but is more common in older adults. It's one of the leading causes of blindness for people over the age of 60. So many forms of glaucoma have no warning signs, and the effect is so gradual that you might not notice a change in vision until the condition is in its later stages. So it is important to have regular eye exams, which include the measurements of your eye pressure. If it's found early, vision loss can be slowed or prevented. If you have glaucoma, you'll need treatment or monitoring for the rest of your life. So there are 5 types. The first one is open-angle glaucoma. So this has got no symptoms in the early stages. The symptoms are gradual. You have patchy blind spots in your side vision. Side vision is also called peripheral vision. In the later stages, you have difficulty seeing things in your central vision. The second type is acute angle closure glaucoma. So this involves bad headache, severe eye pain, nausea, vomiting, blurred vision, coloured rings around lights, eye redness. The third type is normal tension glaucoma. So you have no symptoms in the early stages, but you have gradual blurred vision, and in the later stage you have loss of side vision. You can have glaucoma in children. So children will have a dull or cloudy eye. They'll have increased blinking, tears without crying, blurred vision, and nearsightedness gets worse, as well as a headache. And the final type is pigmented glaucoma. So you'll have halos around lights, blurred vision with exercise, and gradual loss of side vision. Glaucoma develops when the optic nerve becomes damaged, and as this nerve gradually gets worse, blind spots develop in your vision. So this is for reasons that doctors quite don't understand, but the nerve damage is usually related to increased pressure in the eyes. So raised eye pressure happens as a result of a buildup of fluid which flows through the inside of the eye. This fluid, usually called aqueous humour, drains through a tissue located at the angle where the iris and cornea meet. This tissue is known as trabecular meshwork. Cornea is important in vision because it lets light into the eye. When the eye makes too much fluid or the drainage system doesn't work properly, the eye pressure can increase. The most common form of glaucoma is open-angle glaucoma. So this occurs when the drainage angle formed by the iris and cornea remains open, but other parts of the drainage system don't drain properly. This can lead to a slow, gradual increase in eye pressure. The next type is acute angle closure glaucoma. So this happens when the iris bulges. The bulging iris partially or completely blocks the drainage angle. So as a result, fluid can't circulate through the eye and pressure increases. Angle closure glaucoma may happen suddenly or gradually. For normal tension glaucoma, it's not quite sure why the optic nerve becomes damaged when the eye pressure is healthy. The optic nerve can be sensitive with experiences that it's less blood flow. This limited blood flow can be caused by the buildup of fatty deposits in the arteries or other conditions that damage circulation. The buildup of fatty deposits in the arteries is known in a process as atherosclerosis. A child can be born with glaucoma or develop it in the first few years of life. So blocked drainage, injury, or underlying medical condition can cause optic nerve damage. And the final type is pigmented glaucoma. So in this, small pigment granules flake off from the iris and block or slow fluid drainage from the eye. Activities such as jogging sometimes stir up the pigment granules. This can lead to a deposit of pigment granules on the tissue located at the angle where the iris and cornea meet. The granule deposits cause an increase in pressure. There are various factors for this, so it tends to run in family. In some people, there have been genes identified related to high eye pressure and optic nerve damage. Other risk factors include high internal eye pressure, age over 55 years old, being of ethnic minority background, family history of glaucoma, and certain medical conditions such as diabetes, migraine, high blood pressure, sickle cell anemia, and extreme nearsightedness or farsightedness. So diagnosis of glaucoma can occur in a process called tonometry. So this involves measuring the intraocular pressure, testing for optic nerve damage with a dilated eye exam and imaging tests, checking for areas of vision loss in a technique known as visual field test, measuring the corneal thickness with an exam called pachymetry, inspecting the drainage angle, also known as a gonioscopy. Very important to note that the damage caused by glaucoma can be reversed, but treatment and regular checkups can help or slow prevent vision loss, especially if disease is found in its early stages. So the treatment of glaucoma aims to lower intraocular pressure. So treatment options include prescription eye drops, oral medicines, laser treatment, surgery, or a combination of different approaches. So first looking at eye drops. So glaucoma treatment often starts with prescription eye drops. So some of these can decrease the eye pressure by improving how fluid drains from the eye. Others decrease the amount of the fluid the eye makes. Depending on how low the eye pressure needs to be, more than one eye drop may be prescribed. So the prescription of eye drop medicines include prostaglandins, So these include the outflow of the fluid in the eye, helping reduce eye pressure. So medicines include latanoprost, tafloprost, bimatoprost, and latanoprostine. So side effects include mild reddening and stinging of the eyes, darkening of the iris, darkening of the pigment of the eyelashes, eye skin, and blurred vision. So this is usually a once a day thing. Beta blockers can also be prescribed, so these reduce the production of fluid in the eye, helping to lower eye pressure. So these include timolol and betaclol. Side effects include difficulty breathing, slowed heart rate, lower blood pressure, impotence, and fatigue. So this can be used once or twice daily. The next type is alpha adrenergic agonist. So these reduce the production of the fluid that flows through the inside of the eye. These can also include increased outflow of the fluid in the eye. So examples include lopidine, bremamidine, and side effects include irregular heart rate, high blood pressure, fatigue, itchiness, and dry mouth. You can also have carbonic anhydrase inhibitors, so these reduce the production of fluid in the eye. So examples include dorzolamide and brinzolamide. So side effects include a metallic taste, frequent urination, and tingling. You also have the RHO kinase inhibitor. This lowers the eye pressure by suppressing the RHO kinase enzymes responsible for fluid increase. So this is prescribed for once a day use. You can also get miotic or cholinergic agents. So these include increased outflow of fluids from the eye. So example is pilocarpine. You'll get side effects with this such as headache, eye pain, smaller pupils, and dim vision. So the other types of you can get is you can get multiple eye drops as well, or you'll need to use artificial tears, and also you can get oral medicines. So eye drops alone might not bring the eye pressure down to the desired level. So this is usually a carbonic anhydrase inhibitor. So side effects include frequent urination, tingling, depression, stomach upset, and kidney stones. Surgery and other therapies are also available. So you can have laser therapy. So this is an option if the eye drops can't be tolerated. It can also be used if medicine hasn't slowed the progression of the disease. You can have filtering surgery. So this is a surgical procedure called a trabeculectomy. So this involves creating an opening in the white of the eye, which is known as sclera. The surgery creates another space for the fluid to leave the eye. Then you also have drainage tubes. So in this procedure, the eye surgeon inserts a small tube in the eye to drain excess fluid to lower eye pressure. And then the final treatment is the minimally invasive glaucoma surgery. So this can lower eye pressure. This requires less immediate post-operative care and can have less risk than a trabeculectomy or using a drainage device. This is often combined with a cataract surgery. It's quite a lot of detail there for today's video, so I hope you enjoyed that.